In December last year, Finance Minister Matia Kasaija tabled the National Budget Framework Paper for financial year 2024-2025, indicating a 40 billion shilling government expenditure decline as compared to the one of 2023-2024 financial year.
As our debt stock is increasing, our domestic revenue is not meeting the targets. But in order for us to meet the obligations of paying debts, it is increasingly eating away on money which would have been available for ordinary services like health, education, roads, and others. So that is a concern that we need to take note of.
It is against this backdrop that civil society organizations, through their umbrella body, Civil Society Budgetary Advocacy Group, CSBAG, are calling on government to ensure proper planning that will check calls for supplementary budgets for MDAs.
Increased government expenditure biased towards recurrent expenditure. We have always had an issue of a developing country having a bigger part of its budget in wage and non-wage, and that is recurrent, rather than development. And yet, the state of our infrastructure is really in a sorry state. And I sometimes ask you to compare, for example, if Uganda was a very big construction project, Uganda as a country, and it was a very big construction project. And then you have wages, which is 7 trillion, and then recurrent expenditure, which is almost about 70% of our budget. Then you have only about 15% development. It is akin to hiring people to construct your house called Uganda, but the costs of construction in terms of labor and the materials that you need to use is much higher than the capital costs that you would put in. I think it doesn't make a lot of sense.
On the issue of limited investment in primary health care, civil society organizations underscore the importance of prioritizing funding for preventive as opposed to curative services.
We are asking government to put money specifically to address community health workers. We are looking at where the world is moving. We are moving at digitizing the community health systems, having community health workers empowered with the digital tools for them to be able to collect timely data, to inform planning, to inform decision making is the key that we are asking government to do.
We have substantially dealt with the question of access. Now in this country, over 90% of our population live within 5 kilometers of a health facility, and that is good. So what we think government must now emphasize on is the question of how do we functionalize health facilities. And Ministry of Health has been categorical on one of the reasons that has frustrated functionalization, and that is medicine. Medicine has been one of the biggest challenges in terms of functionalization, because when people go to health facilities and they cannot access medicine, they are unlikely to go back to that health facility. And so it's important that we invest in issues of functionalization, medicine, ensuring that we have human resources in those health facilities, ensuring that equipment are functional.
Meanwhile, government has been commended for the deliberate efforts geared at revamping the economy, thus creating an environment for microeconomic stability and socio-economic development.